Yes.
Discussion.
All right. So, good afternoon. With your permission, can I start the video? I'm Dr. Neeraj Israni, and let's start the video, please.
Presenting to you SPECDRAPE, a novel disposable speculum with eye drape. Post-operative endophthalmitis is the most dreaded complication for a cataract surgeon. Eyelid infections leading to contaminated surgical fields are the most common reasons for this. Improper draping, as seen here, is one of the leading causes for this. Hence, to put emphasis on proper eye draping, we need to first get rid of the conventional ways of eye draping. The steel speculum, on the other hand, is proven to cause eyelid tissue damage and lead to pain, ptosis, and difficult to put in deep set eyes. Thus, we had a research question so as to come up with a speculum and a drape combined to make it easier, faster, and patient friendly. Hence, we developed the SPECDRAPE, which has all the above features, on a CAD file and 3D printed the first prototype. The SPECDRAPE not only has a draining outlet for the fluid, but is extremely elastic and designed to completely cover the eyelashes. Here is a demo of the SPECDRAPE on a patient. This is the 3D printed prototype, which is assembled with the adhesive skin part of the eye drape. The SPECDRAPE has an outlet which will drain the fluid into the pouch as seen over here. As you can see, once we strip off the plastic, like any other eye drape, it is adhesive to the skin. Further, the inner ring will go and engage in the lower and the upper tarsal plate. And since this is a 3D printed device, the stretch is not enough, but ideally it will completely stretch and give a very wide field of surgery to the surgeon. This is the CAD file for the latest prototype, which consists of two parts which are joined together with the help of a screw. This screw will help us to increase or decrease the surgical field depending on the surgeon. Final autoclavable prototype is in works and will be available very soon. Thus, the advantages of the SPECDRAPE would be that it is less time consuming since it is a one-step procedure. It not only is a less cumbersome procedure for the patient, but also makes sure that the entire eyelashes are covered, thus reducing the chances of any infection.
Thank you. So, just wanted to add one more thing, that this is still in the 3D prototype stage. The final one will be made out of silicone and poly lining that will be very stretchable because of time constraint. We've spoken to a manufacturer also, and we are in works with other engineering students also, making it much more better. So, sir,
Because when you put the speculum, I saw that the eye, I mean, cornea was as if it was.
I'll show you the I'll show you the dimensions. Just can you?
And second thing, you said it is painless.
Sir, this will be painless because
prototype combined
just one
to
second.
make it.
Yeah, go back, please. So dimensions, it will be coming in, the diameter will be 22, 23, and 24, 25, 26. So depending on the surgeon's comfort, right now it will stretch up to almost, that diameter of the outer polyacetal ring will be 58 mm, whereas the inner one will be in 4 or 5 dimensions from 22 to 27, and it will stretch up to completely that a normal eye speculum can give a surgical drape. In the latest one, we have a screw which we've come up with. So with the help of the screw, you can adjust it, and whatever is your comfort of surgical outfield, you can decide that also.
You said it's painless, right?
It will be painless because it will go inside the tarsal plate and just like a normal speculum.
No, but when you are extending, any of the patient is going to, when it is stretched,
but it is not stainless steel, so
no, but still any material which is stretching can cause. And do you have anything for intravitreal injections? Because we come across more infections in injections than in the cataract surgery nowadays.
So this will be used for all, even for cataract surgeries, intravitreal. It will be universal, sir. And we are aiming at the same cost that a normal drape comes up to. So cost wise also, it will not be more than 50 or 60 rupees per drape.
Third one.